Give me something to hold on, something I can feel. Let me crash to the floor, at least I'll know that it's real. Rock bottom is scary if you've never been before. 'Cause it's easy to lose yourself on the way down. Let me get to the part where I hit solid ground. If I know where I am, then I can start to heal. Give me something I can feel.
Please note, throughout this video, Richa uses the term peripartum depression. The correct terminology is prenatal depression. Experiencing both prenatal and postpartum depression is called perinatal depression. A visual description of what Kriti and Richa are wearing is Kriti is wearing a floral blue and pink top. Richa is wearing a light blue shirt with tiny sweet peppers printed on it. Kriti and Richa are sitting on a beige couch with blue pillows to their sides.
Welcome to Breaking Barriers with KRK. In the last episode, you had asked me about some of the barriers that I faced in the healthcare system. How was your experience with when you were pregnant with your OB?
I am going to preface this with I was very angry with how everything turned out. But after time, 7 years reflecting, my opinion has changed. And I wanted to preface that because I'm going to be talking complete, honest, candid experience.
That's what we want to hear.
So my OB-GYN and my first one was amazing. I really felt like she got me with my son. And then she stopped doing the obstetrician part. So she recommended me to another doctor within her practice. She said I would recommend any of them. And I said, okay, I remember this doctor, I'll go with her. And it was just one of those, I could tell we weren't going to connect the same way, but this was my second kid. So much was happening that you're like, okay, I just want a doctor, it's going to be fine. I was pretty even keel, my normal self. I'm not a big crier. And then one of the appointments, I just could not stop crying. I was in my 35th week. I went into the OB-GYN's office, full tears, nonstop streaming. She walked in and asked how I am. I could not stop crying. I said, I can't sleep. I don't know what's going on. I need sleep. Can you help me? She tried giving me some tools, and I was like, is there anything else you can give me? I think at that point, I was really hoping she'd give me some sleeping aids. And she looked at me and goes, there's nothing I can give you at this time. And so we just kept on talking, and I'm crying through the whole thing. And at the end of the appointment, she looks at me and goes, well, is there anything else I can help you with besides hearing about your sleep? And I was like, I'm coming to you telling you I can't sleep. Why aren't you hearing me? And I walked away feeling alone on the island, like she did not care about my well-being. I'm not saying that's what my doctor was thinking. This is how I felt. I went home and I cried to my husband. I was like, I can't believe this is happening. And the second time I went, she said, I have heard you're talking a lot about sleep. Maybe I should give you a sleeping specialist. And I was like, fine, just give me that number. This was for the second week because I'm towards the end now. I'm seeing her once a week. And it was really hard. It was just not like, it was like I wasn't believed.
So first of all, you were seeing consistently the same doctor, and she knew that your baseline, like your normal, was not
to cry all the time. And she also had her other doctor there that she could have been like, hey, this patient seems a little off. And I'm sure she sees a lot of patients like me.
Yeah.
But I was like, I felt like I was playing for help. And I was like, I'm not sleeping. Is there anything you can give me? Eventually, she did give me Ambien.
But while you were pregnant?
This is while I was pregnant. Okay. And she was like, I'm not comfortable giving you this. I'm like, I don't care. I just need anything. I need to sleep. And then I got to the point where I told my husband one day that I was like, I don't think I'm going to make it in life. He told me to call the OB-GYN. And it was a Saturday. And I'm like, well, I don't know if my OB-GYN's on call. I will just call her on Tuesday when I have my appointments. And my husband was like, no, just call. I am so glad that
You did that.
That my husband forced me to do that because another doctor was on call and she told me to go to the emergency room. That's when I saw the psychiatrist in the emergency room,
Right.
and she referred me to the psychiatric ward.
If the doctor had seen that this is not an ordinary trait, let's seek help. Do you think seeking help earlier on would have helped you?
Yes.
And how so?
Oh yeah, 100%. I became more and more scared of the bed as more time went on, as my anxiousness increased and my crying episodes worsened the more time that passed with me not sleeping. So the Ambien actually did not work. And then through the psychiatric ward, I was medicated and everything. And eventually I started feeling better. But I think if it had been caught in the beginning when I shared with her, it wouldn't have been as extreme as it was.
Yeah, no, that's very unfortunate because you lost time and severity was even more. And then you went into labor.
In the psychiatric ward. So when I was in the psychiatric ward, I felt trust was built between my OB-GYN and myself again when she came to visit me. She visited me in the psychiatric ward, and it made me feel like she really cared about me because she was like, she visited her patient. She took the time to come. And I started telling her I was having contractions. And she said, I think those are Braxton Hicks.
No.
Again, I was like, I'm like pretty sure these are contractions. That one statement, whether she meant it that way or not, I took it in such a negative way. I felt all that trust that I was starting to feel at that moment was shattered because it turns out I was in labor. And I did end up seeing her later that day.
Oh my God.
Not at the appointment, like she thought I would be seeing her because she thought I had Braxton Hicks. It was actually I saw her later that day straight from the psychiatric ward
straight into labor
triage,
and delivery. And so I work at the hospital. A lot of times psych team is like, oh, this patient is having, labor or at least contractions. Let's get the professional who's an expert in the field of OBGYN to come take a look at the patient. Their job is to just do that. What could she, the provider, have done differently?
I was really angry. And I would say for years, I was angry specifically at this one doctor. And then I realized I was putting all the onus on one doctor. And I don't really think that's fair. I don't think it's fair for the doctor. And I'm not a doctor, but I can only imagine to be a doctor and to feel all that pressure of being in charge of someone else's health 100% has to be so hard. I do feel that there should be like a therapist, and especially the OB-GYN's office, because of all the data that's coming out with how the mother's well-being is not always being taken as the primary concern. It's always to the backseat of the baby. I think having a therapist there would totally help with a lot. So every practice having one.
Yeah, I think that's a great idea. You've talked about pre-hospital timeline where you were going to OB's office, hospital, and then once the baby was born, your daughter was born, you brought her home. How much time off did you have? Did your insurance pay for your, time off?
I was able to take 6 weeks off with FMLA, and then was able to take another 6 weeks off later based on our company policy. So I think insurance with pregnancy, I cannot believe we only get the 12 weeks through FMLA, and it doesn't even have to be paid. I don't understand.
Yeah,
so
it doesn't make sense.
If you're tight on money, then there's that stress that you have to go back to work right away so you can start getting money again.
It's not equitable.
No, it's not. Then the people who need the money, who are already stressed because of money, are even more stressed because they have to go to work while taking care of a newborn. And I think this just creates a vicious cycle. And the insurance system can be improved upon. We have the resources in the U.S.
And one of the reasons why mental health it takes a toll is because of all of these reasons that you just mentioned. I mean, your body, for 40 weeks you've been growing a baby, and then now within 12 weeks you're asked to go back, leaving everything behind. 6 to 12 weeks, because sometimes people don't even get the full 12 weeks.
There's some countries that give a year.
Oh, Canada, for example. I lived in Canada. A lot of people are like, you should go back to Canada to have a baby.
Yes.
Because really, truly, it takes a village for you to raise a child and to expect a woman to come back within 12 weeks is totally not fair on the woman, honestly, with all that's going on.
Yeah, I don't understand it. And I think that's a huge gap. And I know there's a lot more noise being made about fixing it. Think it needs to happen quicker. The insurance for moms in general, not necessarily even within disability. It's just really hard.
Yeah.
And I know it's not directly tied to my depression, but like you said, it's a lot of stress already. And I think this could be a big part of why women do end up in these hard mental states.
Yeah, agree. Like lack of support from every aspect possible, whether healthcare, whether insurance.
I also think that all the accountability should not be on one OB-GYN for taking care of a mom. Because if a mom like me, who was in peripartum depression, like my doctor missed it, but guaranteed if she thought it, she probably would have shared it. I think it's a faulty system. I think it's the system that we're in.
Thanks for sharing that, Richa. Any last thoughts?
Better insurance? Thanks for letting me share and kind of explain my story behind all of this and how I think our system can be better. And I know a lot of us think that. And I think we just have to keep on making sure we remain active with what's out there, and then also going out to vote. I think that's really important too, like making sure, because the people that are in charge of these kind of rules with FMLA are the people in Congress. So just keep that in mind.
Yeah, I like that. You tied in voting for this important topic, and we together as a system, we could do better if we get the right elected official in the office. Great conversation. Thank you for sharing your journey, and we will see you next time.
Yes, and I will be interviewing Krithi on dating.
Ooh, lots of stories. This is going to be interesting.
Thank you again, and please continue these conversations.
Take care.
Bye.
Thank you to Mandy Harvey for giving us permission to use her song Something I Can Feel in our intro.